Okay. Good morning. My name is Faith Ann Butcher. I'm the Chief Impact Officer at United Way of Westchester and Putnam. We appreciate you joining us today for a webinar on helping your constituents, providing information and referrals to those who are struggling to make ends meet. This is a specialized webinar that we've created for government officials and public servants to be able to provide you the information on how you can best help those who are in your community. We're going to start today I'm going to go over the latest ALICE numbers, and then leading into, I'll be introducing our Chief Information and Referral Officer, Lenny Jacob, who's going to give you a rundown on the 211 helpline and all the help it will be able to assist you with for your constituents. So I just mentioned ALICE. Who's ALICE? So the ALICE is an acronym that stands for Asset Limited Income Constrained Employed. These are people who are living above the federal poverty level, but below the household survival budget. They have low-wage jobs such as cashiers, healthcare workers, security guards, laborers, office administration, childcare workers. They have no savings for emergencies or for investing in their future, whether it be education, home ownership, or retirement. I'm going to go through ALICE, but you need to know a few terms in order to really understand. The ALICE numbers are by household, so we're not talking individuals, we're talking households, which normally consist of, one or more people who occupy a housing unit. And in our report, it doesn't include those who are in group quarters, such as a dorm, a nursing home, or a prison. Additionally, the household survival budget is the budget that it takes for that household unit to survive. We talk about the ALICE threshold. That is the poverty level plus the ALICE population, and that line that it is before you are actually at a survival level. We refer to that as living below the ALICE threshold when you are ALICE or living at the poverty level. And finally, the ALICE index, Essentials Index, is the basic needs item of the Consumer Price Index, that it just pulls those items out so you can get a real idea of how much it's costing these people to be able to live. So where are we at with that? Well, Westchester, if you can see in the graph here, it's about the same shade as many other counties in New York, but it's still, as you can see throughout New York State, nothing is white. Every section of New York has some sort of ALICE or poverty level, and within Westchester itself, you can see it's full of different colors. For New York, it has 46% living below the ALICE threshold. And in Westchester County, we are actually, the number's right, is actually at 38%. This is important because if you actually go through the trends, you'll see there's more people living as ALICE or below the ALICE threshold now in Westchester County than ever before. The latest report shows a jump in the number of ALICE households that have gone in, and the level of poverty is remaining the same, which means there are more people who are struggling to make ends meet. The reason why this is because the cost of living is going up, is outpacing the wages. The ALICE Essential Index is at a 3.4% level increase over the CPI of 1.8. The low-paying jobs and worker vulnerability. There are less full-time salary positions available. So how much does it actually cost to live in Westchester? Hold on to your seats. So a single adult living in Westchester needs to make a minimum of $45,372 a year just to barely survive. And if you have children, it's even harder. If you are two adults with two children in daycare in Westchester, you need to earn $131,316 a year. And for seniors, a senior adult needs to make over $50,000 a year, and two seniors living together need to make over $75,000 a year, when Social Security is only about $24,000 a year. This leads our communities in trouble. The places with the most with the highest percentages of Atlas in the communities: Mount Vernon, Yonkers, Peekskill, Mount Kisco, New Rochelle. And then in zip codes, you'd be shocked to see, Jefferson Valley at 63% Alice and Croton Falls at 56% Alice. Croton Falls is part of the town of North Salem. You're not used to having to hear about Alice in North Salem. But the towns with the lowest rate of Alice, New Rochelle, Scarsdale, Pound Ridge, the most important thing to note here is it's not zero. These are lower numbers, but families still exist. Families are struggling in every community here in Westchester. By household, if you are leading a household and under 25 years old, you have a 75% chance of living below the Alice threshold. And for seniors, people who've been working their lives, 47% of seniors are living below the Alice threshold. That's more than 1 in 4. It's almost half. For the household type, if you are a single female-headed household with children, you are 65% more likely to be living below the Alice threshold, and over 50% if you're a single male-headed household with children. And just as we've been talking about, it does not matter your demographic. Everybody is prone to being Alice. However, you are more susceptible to being Alice if you are Black, Hispanic, or 2 races. And with that is our latest numbers. But I'm going to hand it over to Lenny Jacob, who's going to tell you about how 211 can help you help Alice.
Thank you, Faith. Good morning, all. Once again, my name is Lenny Jacob. I am the Chief Information Referral Officer. I oversee the 211 program across Hudson Valley, Long Island, and the Adirondack regions. And it's truly an honor to support this vital service in our communities. We just heard from Faith about the ALICE data. It highlights the individuals and families who are working, but still struggling to afford basic needs like housing, food, and childcare. Now, I'm going to share about 211 and how it aligns with the ALICE data to highlight the reality that with the many our community are struggling. So what is 211? So it is a free confidential 3-digit code. It's a 3-digit number to help connect New Yorkers to health and human service needs. This is a national product. It is available in all states. In addition, 211 is designed as a centralized access point for offices like yours and other government departments, allowing those agencies to focus on their essential functions. Just imagine someone in crisis facing eviction, without food, unsure where to turn. So without 211, people would face these moments alone, navigating a maze of services with no map. What does this mean for us? Spike in non-emergency calls to 911. I'm sure increase in calls to your office from residents who previously would have contacted 211 means pulling staff away from their core function. So I want to take a moment to sincerely thank all of you for your continued support in keeping 211 alive and thriving. Thank you. So what you're seeing on the slide, in New York State, there are 10 211 regions served by 7 call centers. Of these regions, 8 are led by United Ways like ours, which play a key role in coordinating local services and services. These 7 call centers work collaboratively across the state to ensure consistent, reliable access to information and referrals for all New Yorkers. Faith, next one. 211 plays a critical role in supporting the community during disasters, whether it's a snowstorm, whether it's a flooding, extreme heat, or other emergencies. It serves as a trusted and accessible resource for real-time information referral and emotional support when people need it most. I just want to name just a few examples. So during Hurricane Ida and the Mamaroneck flooding, when the one in Elmsford, 211 helped residents locate emergency shelters, food distribution sites, and cleanup assistance. During COVID-19 health emergency, 211 was the central hub for information on testing, vaccination sites, financial assistance. In severe weather events like a snowstorm, you can see it on the slide. I actually put two examples from not from the Hudson Valley or the Long Island region, other areas in New York State, how 211 helped. So 211 connects callers to warming and cooling centers, transportation options, and safety updates. Even though last year, thank God, we didn't experience any major disasters, 211 remained fully operational and ready to respond 24/7. Yeah, honestly, this preparedness ensures that whenever the next crisis comes, our community can count on 211 to be there. So go to the next one. So what you're seeing here is the phone dashboard, which provides a real-time insights into areas like, what the status on the staff, their availability, the current wait time, number of calls in queue. This information helps us understand what's happening in the community by showing the volume and urgency of incoming calls. Had the busyness in the call center is based on the pulse in the community. So each day, the type of calls coming into the center is going to be different, what's happening in the community. Next. Okay. So who calls 211? People from all walks of life call 211 seeking help or information about a wide range of needs, including individual facing financial hardship, seniors and people with disabilities looking for support services or healthcare resources, or caregivers needing guidance. Anyone seeking information about community programs like the government services or not-for-profit organizations. Essentially, 211 is for anyone in the community who needs help navigating resources or accessing support. Constituent offices like yours that often reach out to 211 to assist their community members in navigating available resources and finding timely support. Next. So, what's the experience like for community members when they reach out to our 211 center? They'll be connected to community resource specialist who actually listens carefully to understand the caller situation and specific needs, assess callers' needs by asking questions to clarify their circumstances, providing compassionate and non-judgmental support, helping callers, feel heard and supported during stressful times. In some cases, we may follow up to ensure the caller was able to get help and to provide additional assistance. Next slide. I would love to share a few short clips from recent calls we have handled, just to give you a feel for the kind of calls we typically get. Faith, would you mind to play those calls? Thank you.
Thank you for calling 211. This is Marjorie. How may I help you?
Hi, Marjorie. I got the phone with, I'm a resident of Putnam County, New York, and I just got the phone with my utility company, which they had shut up me off during the day. And they had told me to reach out to you guys. I'm not quite sure why, but I'm $1,204. That's all of my bill to get turned on. And we have no power. I have a kid at home that needs homework and whatnot, and they thought that maybe you guys could help me. Ironically, I've done some charity work for you guys back in the day, but it's amazing how things kind of shift around.
That's one call.
Hello. Hi, good morning. This is a call back from United Ways 211. My name is Josephine. How may I help you?
Hi. I was looking online because, like, right now, I don't know if you guys can help out or I want to know like resources around me that could help me out. Like, cause right now I'm facing like a difficult time with my family. I don't think I'm gonna be able to like pay rent on time and stuff like that. And my husband is like low at work right now, and we have 3 kids, so we like stressed out with like how we gonna do the payments. And I was like curious to find out like if you guys could actually help away or just other things around me that could help me.
Okay,
Or what advice can you give me? Or I don't know, like we just like stressed thinking about it.
Just 2 more calls.
Thank you for calling 211. This is Myra. How can I help you?
Hi, Myra. I'm calling because I was in a car accident in March of 2024. As a result, I've had a lot of nerve damage, and it's getting to be that it's a little difficult for me to walk as well. I had to stop working first week in April because I was unable to do so. I did file for Social Security, but my interview with them is not until July 11th. My concern right now is that I am 2 months behind on my rent.
Hello, thank you for calling United Way 211. My name is Keith. How can I help you today?
Hi, good morning. I'm calling from Family Services of Westchester, and I'm looking for some assistance for a family that I'm working with within the Family Strengthening Program. They are in need of some food.
Okay, sure.
Okay, so please note, these are just 4 examples out of over 2 million calls handled by the 211 team across New York State. Every call we handle represents a piece of someone's life, someone reaching out for help, hope, or guidance. This is the same level of care and support that every caller receives from the 211 team, regardless of their location. The calls you heard, those are the calls we handled in our call center. Next. Thank you. So one of the key components of the 211 helpline is it's a comprehensive, constantly updated resources. This database is the backbone of our work. It allows a community resource specialist to quickly connect the callers to the right resources based on their specific need and location, and also to provide real-time referrals that are both relevant and reliable. So, 211 database it's not just a list, it is a living tool that reflects the ever-changing landscape of community services. Its value extends beyond, individual callers. When you think about it, all the resources we have in the system, it supports emergency response coordination, public planning, and community-wide insight into unmet need. Next slide. Okay, we cannot do it alone. We are not doing this work alone. 211 is a part of a powerful trio of support system, working side by side with the 911 and 988, and to make sure no call for help goes unanswered. Whether someone is in crisis, facing an emergency, or just unsure where to turn, help is only 3 numbers away. So let's break it down, those 3 numbers, 211, 911, 988. 211, when you think about it, that's the first stop of everybody help, right? Think of 211 as your go-to guide for life's changes. 911 is for emergency, but but not every call is a true emergency. That's where the connection comes. Oftentimes, dispatchers often redirected non-urgent calls to 211. 988, that's for mental health emergencies. Callers in emotional distress, including those with the suicidal thoughts, get immediate help from trained counselors. And when those callers need more than just a conversation, like help with the shelter, long-term care, or financial stress, 988 connects callers to 211 to continued support. So the bottom line is, each provider and even this three key players, play a unique role, but all share one goal, which is making sure people get the right help at the right time. Okay, the next slide. So let's talk about the impact of 211 is making. You can see from this slide, over the past year, we managed over close to 700,000 interactions. Just our call center alone. So imagine that. That's a 700 times someone, 700,000 times someone reached out looking for help or support. And people are connecting with us through different channels, whether it's a dialing 211, whether it's through our texting platform, or connecting us through our email platform, or searching information from our website. I just wanted to say these numbers are not just stats, they represent real people, real needs, and real moments of trust. So looking at this slide, so what are people reaching out to 111 for? 211 data gives us a real-time insights into the needs people are calling about. These needs are clearly lined up with what we saw in the Alice report, what Faith shared. Individuals and families who are working but still cannot make ends meet. From this chart, you can see it. We are seeing a clear rise in basic needs, and the number tells a story, right? Look at it. Housing-related requests that have gone up 113% compared to before COVID. Food assistance calls have jumped, like that's over 300% increase. Utility assistance, that's up to 59%, and the transportation needs that have jumped like 181%. Now, behind these numbers are real people in our communities, families doing their best to stay afloat. They're facing tough choices every day, like put food on the table, get to work or to the doctor, or simply keep the lights on. This is the reality we are seeing. That's what we are hearing from callers. And while we are proud to be here for every caller, the reality is what we are seeing is these needs grow year after year, but the resources to meet them are not growing at the same pace. 211 is doing everything we can do to bridge that gap, but the demand is real and it's rising. All right, the next one. Let's take a quick dive into the call trends we are seeing across the 3 regions we serve. I'm sure if you had to guess, I bet some of you would name a few of these cities right off the bat, right? Starting with the Hudson Valley region, specifically Westchester County, you can actually see the top hotspots are Yonkers, White Plains, Mount Vernon, New Rochelle, and Ossining. These 5 areas are keeping our phone lines, very busy. Shifting to the Long Island region, we are seeing similar pattern of high activity, especially from the Hempstead and Freeport areas. It's interesting to see where the demand is concentrated, right? And these trends really help us to stay responsive and proactive. As we support callers across our regions, we are not just connecting people with the services, we're also noticing where the system falls short. Faith, can you move to the next slide? Yes, okay. In some of the calls we handle, we are seeing a clear pattern, like people are reaching out for help, but the help just is not there. Why? Usually it comes down to one of the 3 things, either, there is no funding because the program exists, but there is no money available at this moment, or no space left, like, maybe services are full, wait lists are long, or some callers don't meet the criteria, so which means, they are not eligible for it. These unmet needs, it's not just numbers, they are missed opportunities to provide support where it's clearly needed. That's why it's important that we continue tracking and reporting these gaps. So whether it's a 211 and from the Alice, report. So it gives us a chance to shine a light on where resources are falling short and advocate for stronger support systems. Next one. Okay. So you might be wondering, okay, this all sounds great. So what's the real benefit of calling 211? Why not just Google it? Why should I dial 211? I can just go online and search for information. That's a fair question, and it's one we hear a lot. Here is the difference. Google gives you information, but 211 gives you connection, accuracy, and the real help in real time. When someone calls 211, they're not just getting a random list of search results. They are speaking with a trained community resource specialist who can provide verified, up-to-date, real-time local information and offer support in a crisis situation. Whether someone is facing homelessness, food insecurity, DV issue, or mental health crisis. Also, we can address multiple needs in one call. Someone might call, about maybe with the one need, which is maybe rent, but often we uncover other needs like food, childcare. 211 doesn't leave people alone to figure out, their own. We stay on the line, explain the options, and even offer follow-up when needed. Because at the end of the day, 211 is not just a number, it is a lifeline. Next. As we close, I want to leave you with this. 211 is a free, confidential service available to you and the people you serve. Whether someone is facing a crisis or simply needs help navigating local resources, it is available 24/7. Please help spread the word, because the more people who know about 211, the more people we can help. Thank you.